So we're talking about pediatric migraines today, and I'm super excited for the series, so thank you for coming, and thanks to everybody that's logged in live. It's going to be myself, I'm Lisa, Dr. Brekke, sorry, Lisa, and Dr. Stephen Gutu, and then next Thursday it's going to be Dr. Marla Shapiro and Dr. Tessa Klein-Walterink, who is our occupational therapist. So thank you for joining us for the two-part series. If you're here tonight and you can't make it next week, we are going to do it live again next week. We do really love in person because we like the questioning and getting to talk to you before and after. But if you can't make it, we will be doing it live again next week. Okay. So the whole point of this series is to teach you about pediatric migraines, what they look like, what you can do about them. So the biggest one for me is migraine is a neurological disease. You have migraines attacks that can have migraines, can have headaches, sorry. Just because you have a headache doesn't mean you have a migraine. And just because you have migraine doesn't mean you have headaches. So it's really important to tease those out. And that's where we're here to help you tonight. And so first we're going to start with Dr. Stephen Gutu, who is a pediatric neurologist.
Thank you. Thank you for being here tonight. And I know that it takes a lot just to take time from your busy schedules and be here. And we're excited that we're not just talking to some empty chairs. And I think I've spoken to some of you who have either migraines or friends with migraines. First of all, I'll start by introducing myself. I'm Stephen Gutu. I have my own practice, Pediatric Neurology Divine Solutions, here in West Des Moines, which is in Windsor Heights. And I love what I'm doing now because I enjoy pediatric neurology and I enjoy serving God. So I'm going to start by thanking God for the opportunity to present and talk about migraines and give all glory to Him. People ask, what is a pediatric neurologist? That's a tough question. I'll try to break it down. So basically, pediatric neurologists see kids with disorders of the brain, spinal cord, the nerves, and the muscles. So it's quite complex, and you should pray for them because it can be complicated. So you can have disease ranging from epilepsy, cerebral palsy, stroke, peripheral neuropathy, migraines, headaches. There are different types of headaches, but today we're going to concentrate on just the migraine type and several other different conditions involving the brain, the spine, the peripheral nerves, and the muscles together. Migraine is not just another headache, so you can have a headache from anything. There are different types of headaches and different types of one that is most common is usually the migraine part of it. I'm not going to use any big words or become too technical. I'm just trying to simplify so that anybody can try to identify when kids present with symptoms. And Lisa will also present on some of that. So most of the time, I think just identifying, the way I'm going to approach is like when I see you in clinic and how you might want to recognize if your kid at home has a migraine. So usual migraines can present in different phases. There is a chart here in front of you. Usually sometimes kids can have what we call a prodromal phase. That's usually occurs like 1 to 2 days before the actual migraine starts. And kids during that time, they can start to be moody, they can present with depression, they can be excitable, irritable, and they can start to have frequent yawning episodes. Some parents will tell you that, well, I think I know that something's going to happen because my kid has changed in the past 2 days. And then you have the sensory phase, which is phase 2 on the chart there, which is usually known as the aura phase. 1 in 5 of patients with migraine usually experience these auras, which are sensory. They can complain of light flickering, or seeing some complicated light shapes. Partial vision loss can happen during that time. And also they can start, some of them start to have craving for food stuff during that time. and then the migraine itself starts. So sometimes that's when they start complaining about nausea, abdominal pain, loss of appetite, light bothering them, what we call photophobia, noise making it worse, phonophobia, ringing in the ears, throbbing pain. Not everybody will maybe say it exactly like that. Could be pulsating, or some kids, little kids will tell you that, oh, I can feel like my heart is beating in my head. So we just had a conversation earlier on that, can kids articulate if they have a headache? So that question comes up most of the time. My answer is, as long as you have a brain, you should experience the same symptoms, right? But kids cannot communicate. There's also talk that kids with colic could be a precursor of future migraines, and other features like that. So if you give, and we talked about this, that if you give a child, and she's going to talk about that, a paper to write or draw, say, can you draw to me what you feel? Keep with 3, as long as they can hold something, or 4, 5, and 6. You'll be amazed that they might be able to articulate their symptoms just by drawing what they feel. There's a famous neurologist who did a study, and it's actually it was published, and you can see the different shapes. Sometimes somebody holding a hammer to the head, kind of like pounding headache. Somebody drew a stick figure of somebody beating drums in the head. It's pounding from the head, boom, boom, boom. So they can articulate, if you really know how to ask them. Sometimes they cannot. I mean, so some of those things will tell that they're the telltale signs that a kid something's happening. Noise, all of a sudden they irritable, they're holding their head, they don't want any noise, they want you in a dark, quiet room. Those could be some of the symptoms. And then extreme fatigue can happen around that time as well. So I've asked for all those things. Do you feel dizzy when you get up quickly? Do you feel like the room is spinning? So those are other things that you're asking and looking for in kids as well. So in adults, that might last about 4 to 72 hours, all the symptoms, the headache presenting at the same time. But in kids, it could be anything from a few minutes, 30 minutes to an hour, 1 to 2 hours. And then resolves. Also, it's not unusual in the pediatric population to present with a migraine symptom without the headache. So that's why sometimes people miss the diagnosis. So a kid can present with abdominal pain, nausea, photophobia, which is the light sensitivity, or the phonophobia, the light sensitivity. And it could be just a migraine symptom. So if somebody pays attention, the tingling numbness could also present without headache. So it's not unusual for kids to present like that. So after the headache, you now have the 4th episode, which is the prodrome, which is your usual leads to the recovery phase for another 1 to 2 days, or the post-headache phase. Kids can present with extreme tiredness or confusion during that period. So remember, all that leading to a headache, migraine. It's kind of complex for me to explain at this point, but there are some changes happening already within the brain. There's something called cortical spreading depression. I'm not going to touch on that, but just think of, I'll give you an example as well. Think of the war front. And then you're reaching out to everybody, say, hey, the wall is heating up here. Can you send us some reinforcements? So you say to the eyes, hey, can you send us some reinforcements? To the skin, can you send us some reinforcements? So basically, that wall front that's spreading the wave is what you call highly metabolic. It means you need more oxygen, you need nutrients there, so blood has to come there. It has to come from somewhere. So you're drawing the blood from your eyes, drawing from the gut, drawing from the skin, so that the symptoms that you feel, like the tingling numbness, blurry vision, double vision, and other things. So is it spreading? Those are some of the symptoms. Just to put in a nutshell that those symptoms, it's a change that's happening around that time. And the recovery phase would take almost like the reverse of that. Is you recover and you're saying, okay, we don't need those reinforcements, you can go back to your unit. then blood comes back to the skin, the tingle numbness improves, your vision starts to improve. But anything beyond that, you're going to touch on that. So that's usually the normal cycle of the headache as it develops. And you know that it's supposed to recover. And sometimes you talk to your primary care physician, you can take care of that, you take over-the-counter medications and things like that. And the question later on is, when do you seek help? And I'm going to touch on that a little bit. So if most of the people know, most of the patients will know their symptoms that they normally have, but if you start to have new symptoms, or the symptoms are lasting long, or the medication that used to work, it doesn't help anymore, you need to talk to somebody, talk to a physician to see if you need to see a specialist with regards to that. So in kids, we measure how this is debilitating by several factors. Are they functional? How many school days have been missed in the past few days, in the past month? So when you see a doctor, they'll ask you about all those things. What is the frequency of your headaches? How long do they last, and what's the intensity? So they might give you a scale. When kids, give them a scale from 1 to 10, and you ask them to rate their pain sensitivity at that time. So before, what you can do too before you see a physician is try to record and keep a journal. How many headaches in a week? Is it every day? Do they come, is there an onset time? Are they random, or is it a particular time of the day when they start? When do they get better? What makes them better? And if you take Tylenol, ibuprofen, does the headache improve? So basically that's what most people do, over-the-counter medications, putting ice on the forehead, going to a dark and quiet room and see if that helps. But sometimes, as you know, that those measures may not be enough. So some kids will tell you that they have a headache and it's lasting the whole day. Or sometimes you may have a headache that you call hemiplegic migraine, which looks like a stroke. Can't move one side of the head, of the body. They feel tingle numbness, or they feel like they are weak or paralyzed. Or sometimes a kid can show up saying they're seeing all in black and white, which can happen. Or they're seeing spots and dots. Or you have distortion of shapes. Kids say M&Ms, which are really small, they look this big. And one kid was going down the stairs and his hand looked so far away, condition that he called micropsia. So all those things should prompt you to say, something is new, I think we need to see somebody. So you see your primary care physician, who might send you to a specialist, in this case a neurologist or other providers. So when I see a patient, I try to find out, I ask a lot of questions. So I tell them you need at least an hour and a half, because I believe looking for the triggers and risk factors is more important than just going in and giving medications. I try to avoid giving medications on the first encounter unless if it is necessary to do so. So there are many triggers that can cause headaches. So things that I look at when I'm taking the history, family history, is there a family history of migraines? Most of the time there is a history, and you know that there is a genetic factor as far as headaches are concerned. And I usually like it when the parent who has the headache comes with the child to the clinic, because when you are doing the educational part of it and asking about symptoms, most of the time you ask and the mom or dad will say, oh, no, that's me, that's me. And then we come to the triggers and everything else, you feel like you have done the whole family therapy, because they can identify with some of the things that you're asking. So things that I look for in the parents, you can start looking into parents and providers, things that can trigger headaches, sleep. Usually one of those triggers is inadequate sleep. So you look at the factors of How much sleep are they getting? Do they have problems falling asleep, your sleep initiation, or staying asleep, sleep maintenance? Do they have loud snoring? Because you're not just looking at the quantity. I think most of the time look at the quantity of sleep. Everybody says 9, 10 hours, 8 hours. But the quality is also important because a kid might go to bed at 8 p.m., but they're busy throughout the night. So the quality of sleep is not as what you thought it was. They could be what I call sleep ninjas. They could be moving around, restless, sleep talking the whole night, waking up a few more times. Loud snoring, which is common, especially kids who have large tonsils or they on the big side, obese. So those are important factors. So good sleep hygiene is something to look at. One of the things I look for and I make sure I do not miss is hydration. That's usually one of those two things, either inadequate sleep, hydration, stress, and a few things. So hydration, a good measure would be whatever the weight of the child is in pounds. Let's say you weigh 120 pounds. Divide that by 2. So roughly looking at about 60 should be like your, I mean, it's on the maximum, but at least that's what you should be aiming for. Say, well, I'll drink 60 ounces of water per day. Somebody said if you take a sip of water every 20 to 30 minutes, you should be reaching your maintenance by the end of the day. So with that, are kids constipated? Are they dry as a bed? Are they constipated? Usually they go hand in hand. Kids who are constipated, not drinking enough water. Those are things that you could be doing at home before you see a provider. You go equipped with that. I would love it if somebody comes with the information. So yeah, he's constipated. He's dry. You've been using Miralax. How much do you drink? If a kid has to think how much they drink per day, I know they're not drinking enough water. So that's usually one of the things that you could do, correct migraines, things that you could try at home. And then I look at sports or activities. Because the two go hand in hand. Sports, activities. Most of the time you get a history that I get a headache when I'm doing sports. I go to PE, I get a headache, and I have to sit down. They're like, okay, how much water do you drink? Just like now, it's what, 2nd of February. I asked them, have you drank any water since Thanksgiving? So you keep thinking, yeah. Well, we don't have to think. Thanksgiving was a long time ago, right? So it means they don't drink water. So you want to make sure that before they do any activity, they drink water before, during, and after. And we actually encourage exercise as far as migraines are concerned. She's going to touch on that, I'm sure. Those blood flows better, and then when you're exercising, you release those endorphins, which we need. Those are God-given, you got them. So you got to release them, you exercise, but if you drink and you're dehydrated, the headache is going to get worse. So when I hear that history, kids don't drink enough water, exercise, they get headache, I want to make sure that they drink enough water. And then you have to find out why they're not drinking enough water. Most kids, they have restrictions at school. The little kids, elementary school kids, they'll tell you that, oh, you get about 3 bathroom breaks. Well, the kids are afraid to ask. They don't want to drink because then they use all the bathroom passes. So my number one question is, are you allowed to have a water bottle in front of you? They say no, I know we have a problem. Are you allowed to go to the bathroom as much as you want? No. So you know there's a problem there that needs to be addressed. So it means we need to advocate to make sure that the teachers understand that the kids can drink water as much and have liberal bathroom breaks or unrestricted bathroom breaks, because I'm pushing them to drink and they are being restricted to school. And then also something, when you come to other triggers, hunger. Some kids, also some because they're taking some medications which make them less, but they have a loss of appetite. Most kids who skip breakfast, sometimes they have time before lunch. So you ask them, what time is lunch? Lunch is at 11:25. What time do you get headaches? 10 a.m. Did you eat breakfast? No. When was the last thing you ate yesterday? 6 p.m. That's overnight fasting. So they're not breaking that fast breakfast. They're not breaking that fast, which means they've been fasting since 6 the previous day, continuing. And then, as you know, I'm just putting it in mild words. You need to maintain or have a consistent supply of nutrients to maintain the chemical balance of the brain. So it goes without saying that sometimes hunger is a trigger of the headaches. And then you also look at what other things, when is the headache? So if a kid says the headache is after lunch, you start to think of dietary triggers, like do they have preservatives, something that they ate at school, or is it things that you look for like red dye 40, which is, I think the United States is a bit behind because in England, Europe, they are banning the use of red dye 40. Not only does it trigger headaches, it can cause, I think, some other behavioral aspects in kids who are prone to that. So things like aspartame. I'll give you an example. Getting a nice journal to say, okay, headache is at 1 p.m. Okay, you journal, what's the last thing you ate before the headache? You'll be surprised that sometimes we are eating some foods which have some triggers in them. I'll give you an example that I use almost every day. This mom comes and say that, oh, you know what? I made a journal, I couldn't find anything else. But every time I give the kid an apple pie or an apple sauce, doesn't get a headache. But I cut some apples, with headache. Is that mind-boggling? It is, right? You think processed foods should give you a headache, natural shouldn't give you a headache. So I could see the dilemma that she was facing because I was bored. As a dietitian, I asked a few people, nobody could give me an answer of why would the kid have a headache after consuming that. So one day a farmer came to the clinic and I gave him this scenario. I said, hey, I got this story. And then he just pulled on his beard, like, doc, that's easy. You know, I felt like, I said, that's easy. I was like, why is it easy? Oh, doc, on farm, they spray chemicals. I was like, oh my God, I didn't think about that. So unfortunately, that mom didn't come back for me to confirm that, well, did you actually peel the apples to see if it doesn't get headaches? She didn't come back because I think maybe she figured it out herself. So why did I give you that scenario? Because you could be thinking that I'm doing everything else. The kid is sleeping well, drinking enough water, we're doing everything right. But if we journal carefully, and you might start to see a pattern emerging. Other kid used to call me every Monday, bad headache. Thursday, Wednesday, Thursday, Friday, no headache. Friday start to get headache. Saturday, Sunday. Well, father was off on Friday. He used to be a truck driver, and then take the whole family for pizza. The girl would have all meat pizza. So by the time she suffering headache, so you could process foods, nitrates can trigger. And then you also have some seafood sometimes with sulfites which can trigger headaches. So why am I saying this? Just careful following what time do you get a headache? Is there something that is precipitating the headache? Is it because you're in front of a computer screen? Is it because you exercise or drink enough water? Is it something that you ate, or maybe didn't eat anything for 12 and a half hours? So you could actually fix some of these before you see neurologist. Visual stimulants, it's a hot topic right now. Because after the pandemic with virtual learning and everything else, I stopped asking how many hours, because kids are pulling 6 to 8 hours of on-screen time between school, Chromebook, phone. They have so many gadgets and video games. So 6 to 8 hours. So in my world, we used to say 2 hours to the seniors, right? And then 1 hour for the little people, the elementary and junior levels. But it seems it doesn't hold anymore because they have so much exposure, and most of the kids are sensitive to light, and then they spend time in front of the screen. So visual stimulants, some things that we don't think about, those are also triggers. Stress is big. I don't know if any teenager doesn't have stress. Teenagers are not normal, right? So actually when I see a teenager without stress, I kind of get worried because they're not normal. Sorry, they're normal people. Yeah. So stress is a big thing. It could be from home, from school, so we really need to dig in. Kids could have comorbidities, they have depression, anxiety, the home situation, so we have to dig in and see what's going on. Is there something that we can do to distress them? So when you're doing all of this, it already kind of gives you an idea of where do you want to send the child. Is there a lot of stress? Because some of these things are easy. You drink water, you pee your brains out, you eat. you avoid certain dietary triggers, but the stress sometimes can be too much, especially in this day of social media. I forgot to mention when we said pediatric, what are pediatric neurologists? We see from a few hours old to adolescent, up to 21. Some clinics will discharge patients when they're 18. I see them 21. But if a kid has other comorbidities and their brain is like maybe 12-year-old, they might be 24, 25, I still see them because they are still kind of within that almost pediatric mode. Okay. So stress is important, big trigger. I look at the medication that a kid has. Could it be the medication giving them headaches? So we all know that if you take over-the-counter medications, which is your first line, Tylenol, ibuprofen, Aleve, and all that, if you take a lot, just like people drink coffee, you start to get overuse rebound headaches, right? So we don't advocate for taking for more than 3 days a week. Some days you might do that, like a kid has COVID, there's something going on, they have fever. Well, for that time, yes, but you want to be taking them all the time. So look at other medications which are also potential triggers. Family history we talked about, you can't change it. There's nothing we can do much about it. And concussions, they can also be a precursor. They can start off as post-concussive headache. She's going to touch on that, and then later on present as migraines. Somebody who has a predisposition might go that route. Not all kids with concussion end up with a migraine, but now and then it can happen that way. So when I'm done with all that, I now know that, well, the kids, all the boxes are checking in. This is a migraine, 2 types, mostly migraine with aura, which is the most common, and then migraine with aura, not as common. And then after that now, I choose how am I going to approach this. So depending on all those things that I gave you, remember the sleep, inadequate sleep, dehydration, doing sports without drinking water, maybe it's hunger, or it's a trigger, dietary trigger, stress. Is it because they're spending 16 hours in front of a screen, or they had? So that's how the plan comes in of how am I going to approach this. Is it a kid who needs an MRI? Most of the time, most kids don't need an MRI for just a brain MRI. But the after doing the neuro examination, we might pick up a few more things that will say, well, I'm not so sure about this. I think I need to dig in a bit deeper. So most of the time I start with conservative treatment. Some parents are not very fond of that, but I feel that if a kid has all those triggers, and in your folder I have that which lists the things. If I don't take care of the kid who's not drinking water, the one who's thinking about Thanksgiving, last time they drank water, kid who's not sleeping well because they're watching Netflix shows until 2 a.m., kid who's eating red Doritos, red dye 40. If I put them on a daily medication, it's like putting a Band-Aid on an infected wound. So I like to start with conservative treatment. Let's get back home, do lifestyle adjustments, including exercise, instead of just being in front of a screen. And then with that, you might also want to address short-term treatment. Remember the Tylenol, ibuprofen, those are short-term treatments, but there's some that we can use as well for short-term treatment, the triptans and the like. But they're supposed to be just as needed when the other measures are not working, and they're not supposed to be used daily. But just like any other medication, they do have side effects, but depending on how a kid is going. I had a kid who had missed 94 school episodes. That's a lot. 94 is a lot. Mm-hmm. So we want to make sure that are we going to give Tylenol ibuprofen next time they have a headache? Or do you want to give them something at school? Let's make them lie down for 30 minutes to an hour. The headache improves, go back to class. Because most of the time they might give Tylenol ibuprofen, call a parent. By the time you're getting there, or they're getting there to pick up the kid, maybe that medication is kicking in. By the time they get home, the headache has improved. So they've missed a few more periods. So those will be the approaches that you want to do: the conservative lifestyle adjustment, then the acute short-term treatment. All that is not working. Kid keeps on missing school. They can't do their homework because the headache is lasting forever. They're missing on the social life. They're just miserable. That's when you want to talk about daily medications. At that time, depending on the presentation, maybe some other tests would have been done, like a scan of the brain, brain MRI, or sometimes if it's an emergency room, they might have done a CT scan. And then we talk about the daily medication, depending on how a kid is presenting, how are they functional. And we want to restore that. So if your headache, especially for the adults, if your headache is lasting, you have more than four severe headaches per month, or you have several attacks, more than 2 per week, or you have, sometimes if you might hear a doctor talking about migraine headaches per month, like if you had 15 migraine headaches per month. So those would be the conditions that make you feel like, well, we want to do something so that the headaches become less. Now I'm going to say something depending on where you're from. It might be controversial that migraines themselves, there's no cure for it, but we can manage migraines. So if we get that right, that person who's going to invent that cure for migraines, they're going to be sitting pretty. Right now, there's no cure for migraines, but we can manage the migraines. So other headaches too, we're not looking like, let's say, teenagers, adolescents, they could be hormonal. So you could see a certain pattern. I always tell people that, well, what's your name again?
Angela?
The dude.
Oh, what's your name?
Oh, Robbie,
Robert, how old are you?
15.
Right, 15. Yeah, so already to me, you already have one disease, right? Teenager. Right, so if you're of the opposite sex, you would have had 2 right now. Don't get me wrong, I'm just saying teenage, female. Right, so people look at me funny and go, he's a sexist man, this guy. No, in the sense that when you're a teenager and the hormones, the estrogen and all that increase, that can cause havoc. Yeah, can actually make headaches worse, and some people may improve. But there can be that hormonal pattern that you can be seeing, and it's good if you start seeing that, and because there's a different approach to how you treat that. So it's very important to know that. So teenage female, I'm like, I got 2 diseases. It can be funny. First thing, you get 2 diseases. So you got 3 more years to cure the teenage disease. Yeah? So good. I mean, that's a cure for teenage, right? You just outgrow it. So the headaches have become severe in adults, missing school, older kids too, wake up, start missing school. Those are other reasons to seek medication. There are different medications we can use, and that's not the scope of this visit. That's when you want to come and see me or other neurologists, and then we can talk about that. But however, those are, we're talking about acute rescue medications, talking about daily preventive medications, right? That you can give daily. When you say, well, I've tried everything else, but kids missing so much school, it's debilitated. I have to correct something else. A kid can have one headache that lasts several days. So they might miss 3 school days. So that's when I want to talk to say, okay, do they want to miss 3 days every month? Or can I do something about it? They're not adequate enough for me to give the daily medications, but at the same time, the kid is stressed out, the GPA is dropping. So those are other things that you could use as a criteria. Alternative medication can be used. Right? People are doing herbal medications, botanical supplements, and all that. I don't have anything against any of those things. Because some things can help. People take magnesium, they can use the other mitochondrial cocktail, ubiquinone, and a few other things. They can help. But before you start any of these herbal supplements or botanical supplements, talk to somebody, because just like the regular medication, they do have side effects. The unfortunate part sometimes is that they are not as well documented and studied. So once it comes to that, I've seen people that have 9 new supplements that the kid is on. It's good to be natural and try all the other things, But just make sure you talk to somebody to make sure that, well, what could you be expecting as far as side effect is concerned. Other non-drug therapy like cognitive behavioral therapy, maybe say stress, tension, and the few other things. And then, of course, depending on how the kid is presenting, was it following a concussion? Do they have a vestibular imbalance? Do they have dizziness? That's when you also want to refer to other providers that you work with as a team. And this is going to talk about vestibular rehab and how she approaches that as well. And then you have also other providers who provide, the same would do the cognitive behavioral therapy, the neuropsychologists, and other approaches. I also don't have any issues. There is a time and place for seeking chiropractic help, just like going for cognitive behavioral therapy and all that. Just like with anything else, I just say when it comes to, because I'm the brain, just say that if you have to avoid manipulation of the neck, that would be great. But I don't, anything that can help a kid to restore function. That's why I tell my patients that if you find something else, because sometimes patients can hear about something else before we do because they're busy looking. I don't have an issue. I need to look into it first and see what it says. But anything that can help a kid to be functional, I'm all for it. But I want to have a systematic approach to everything else. So that would be my approach when I see in the clinic, and then we talk about other things. But most of the time, I try to make sure that if we're taking care of the risk factors that can be resolved with the conservative approach. So this was designed by one of the kids from the clinic. I think I have some copies there. You can have your own. These days, you have, because of technology, you have your own. You can use your phone to track your headaches. But I'm more visual. I like to see, just like in this week, if the head is documented, like, is there a pattern that's showing up? Is it dehydration? Is it because the kid didn't drink? Is it something that they're eating in school? Is it the stress? Is it the 16 hours in front of a computer? I started that approach. And then we'll see what the new exam shows. And then I'm going to say something else. It's off script, Lisa. It's off script, but not off the screen. Remember, environmental, lifestyle adjustment, exercise, all that. I also think of the spiritual aspect, and that's why I said I'm enjoying, because I believe in the power of prayer. The patient doesn't have to be a believer, but I am. So that's why we call divine solutions, because I seek godly counsel. Make sure that I'm giving godly wisdom, because it's complex. I don't want to lie. It's very difficult when we have the lives of your kids in our hands, and neuro is not easy. So I pray to make sure that I'm making the right decisions, I'm getting the right, but we pray, not me, we as a team, we pray, we believe in that concept of godly counsel. You don't have to be, but I like it when I partner with the families and we pray together to see how we can help a child be more functional. So I do not apologize for what I believe in. Galatians says, so 1 Corinthians 15:10a says, but by the grace of God, I am what I am. So I'm not going to make apologies for that. That's my approach. You don't have to come and pray, but I think the spiritual aspect and spiritual approach of it is very helpful. I'm going to close with this. Psalm 103 says, bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquities, who heals all your diseases, who redeems your life from destruction. So I believe in the power of prayer. And like I said, maybe you might not like what I said, but I do the other things. Your faith does not affect the approach or the quality of service offered. That's my pediatric neurology in a nutshell. You can find us on the internet, and if you have questions later on, I'll be available to answer. And there's a booklet, Living with Migraines, and another one in the folder too. Thank you.
Thank you, Dr. Gutu. So he gave you a lot of information. So that's when you come to me next. So my name is Lisa Brekke. I'm here at Kinetic Edge Physical Therapy in the Des Moines location. I have my doctorate of physical therapy from Sacred Heart University in Connecticut. Physical therapists have to have a bachelor's degree, and then they have to go get a doctorate degree. It's required now with direct access in all 50 states. Direct access is a liberal term because it depends on the insurance company that you have. Medicaid requires a referral from a physician of some sort, but other providers are a little bit more lenient with that. I'm a board certified specialist in neurologic physical therapy. I only treat individuals with dizziness, post-concussion, or migraine disorders. So that's what I see every day, all day long. So physical therapists are movement experts. We try to improve your quality of life through exercise, hands-on care, and education. And I'm just going to do a quick question. Out of everything he just told you, do you remember all of it? Everything.
Yeah.
Yeah? Yeah. That's where I come in, because I repeat it all the time. If you have questions following your appointment, I answer those, or I send you back to him. We cover things repeatedly, because oftentimes, as he says, we address certain things conservatively, and then you get into more layers. So as you address the food, and the hydration, and the screen time, and the sleep, other things start to come out. And you see physical therapists a lot more than you see neurologists in general. He's an exception, he's private practice. You can probably see him more often than you can somebody in a hospital-based system. But you tend to spend more time in physical therapy than you do with a neurologist. So we just get more hands-on time with you, more time to talk to you, more time to ask questions. We also can tease out more of your symptoms that you may not have caught in the beginning as we go. So I may pick something up as we start to do something. You might have some abnormal head movement or some balance issues or difficulty when we go into like aerobic work. So it's nice to have an extra set of hands in your tiered approach and not just a physician on your team. We also do hands-on care, so there tends to be, especially in adults, but kids have it too, cervical involvement. If you've been in a motor vehicle accident, I guarantee somebody's talked to you about whiplash at some point. Our society says it's whiplash, it'll heal in a couple days, you'll feel better and move on. However, kids don't necessarily say their necks hurt. They come in here a lot, and they come in for post-concussion, and they have abnormal neck movement, and then I actually touch their necks and they hurt a lot. They don't articulate that they hurt. So making sure that we treat that in kids, it makes them less likely to have chronic pain as adults. So if we can get to them when they're younger, they're better off in the future. And if they learn to manage their migraines like this, they get better at being as an adult, versus if you're an adult and you've had chronic migraines or very high episodes of migraines as a child and you don't know how to treat them, you're not going to know how to treat them as an adult. So my goal in life is to teach all the kiddos how to do it. So first thing, we can go over lifestyle modifications. So we do talk about sleep in PT. I do talk about like a well-balanced diet in PT, making sure that kiddos aren't skipping breakfast. And they're having their lunch and their dinner. I've given notes for school if they need to hydrate more often or if they need to be snacking. Post head injury, it can be really important to be snacking, so making those modifications as needed. And then also addressing anything else that's going on. I have patients who have Ehlers-Danlos syndrome, which is a hypermobility syndrome, which gives them typically upper cervical joint laxity and some instability in their spine, and they can really benefit from cervical work that focuses on stabilizing that, and that can reduce one of their potential triggers. Plus I have individuals who have new onset migraine post brain injury, and then new onset migraine post whiplash. So just addressing those hands-on things that are happening to reduce their trigger episodes. The other thing I do is, this is the phase that he went over. I give compensatory techniques for each one of them as able. So nausea, we talk about like just over-the-counter stuff like ginger chews and sour candies can be really helpful with that if you're really struggling. I also tell adults to do that because it can be really helpful if all of a sudden you get a bout of nausea and you can't get to your meds or you can't calm yourself down, just something quickly to take care of that. Muscle stiffness is a prodrome symptom, but it can also be a cause of migraine. So teasing out, is it part of your migraine phases, and that's when you should be taking your rescue medication, or is it actually something that's leading you to have this continuous phase of migraines? And then we also address like sensitivity to light and sound. I like tinted glasses if you're struggling in classes, whether they're the rose tinted or even just like the blue light filters, both on the computer and on your glasses. If you need glasses, you should be wearing them because a visual demand can be a problem. Kids don't tend to like to wear their glasses if they're not already doing it or it's a long-term thing, so new glasses can be hard. Really encouraging your kiddos to wear them because they can be really helpful. And there is a nightlight on your computer that you can set if they don't have the blue light filter in their glasses. It's not as effective as some of the glasses, but it can give you an idea if it's helpful. And then it's also important to know that like some people just say, oh, I'm sensitive to lights and sounds, but at the same time, it could be a trigger or it could be one of the phases of your migraine. So just trying to help you tease out which one's which. Do you truly have a light sensitivity, or are you kind of sitting in this cycle of migraine? And then we review migraine triggers a lot. Again, the neurologist can give you a lot of information, but then you leave and you're just like, what am I supposed to do with this? So we can help continue that tracking that they want you to do, or pick it up if you haven't gone to a neurologist and you're coming to physical therapy from your primary care physician. Like I get started with the same things he does. I just don't do medications. And I can get you to him if needed. So just kind of being that middleman for all the providers, because migraines can take a pretty extensive approach. It's not just one thing that can fix them all. Lifestyle management, if you're episodic, can be a really good thing, but sometimes there needs to be other factors, and you need to have somebody that knows that you need those and can connect you to them. The other conditions that play a role, so I treat post-concussion brain injuries, whiplash, and I've also talked to older adults, middle-aged adults they use ibuprofen a lot for back pain and don't realize that it's also giving them daily chronic headaches. So just things get caught in physical therapy because we get to talk to you a lot and we get to spend time with you. Our sessions are 40 minutes here at Kinetic Edge. They're one-on-one, and we get a lot more time to figure out what's going on with your life and how to help you manage that. The big thing with whiplash is 1 in 7 patients with chronic daily headaches started with that secondary whiplash. From a motor vehicle accident or a bike accident, or I had a kid last year who got tripped and went back and smashed her head on the ice, and she actually has video of it, which is horrifying that they video things like that nowadays. But lots of different reasons that you can have chronic headaches, and then whether is it chronic headaches or is it migraine, like with all the additional symptoms. And then my big push, I'm a vestibular therapist to start with. Vestibular is your inner ear. If it's off, you are dizzy, and you'll often find yourself reaching for things to keep yourself steady. You don't want to be in the dark. You don't want to close your eyes. If something's going on there, vestibular migraine is something that I often catch because patients come in here dizzy, but they have no headache. And so they don't understand that they're in a migraine cycle. But then when you ask questions, you can tease out that they want to be in the dark, that they don't like lights, that they wear sunglasses a lot. That they have a lot of the other symptoms that go along. They just never have the headache. So nobody has put 2 and 2 together that they have vestibular migraines. One of the biggest drawbacks with the criteria for diagnosing a vestibular migraine is they are relatively new. They don't take into account that children often don't have a diagnosis prior of migraine. Dizziness in children, this is the #1 cause. Is this and benign paroxysmal vertigo. And they are very similar, and they often are precursors to actual regular migraines when you get into your 20s and 30s. So just a highlight there. And then as he covered lifestyle modifications, making sure that your sleep is good. Next week, Dr. Marla Shapiro is going to be here, and she's a neuropsychologist who specializes in sleep. Meals. Not only are they eating regularly, but they're also eating balanced meals where they're getting all of their nutrition. Making sure they're active. There is a big balance between being not active enough and being too active when you have a migraine condition, and building up appropriately into that activity. You can't, a lot of times kids don't participate in sports until it's the season for the sports. And they're very deconditioned when that happens. And there are different things we can do to grade their activity and get them into their activities in a healthier way. Relaxation is really important, making sure that they have time to unwind and calm down their central nervous system so they're not always in this excited state. And then when you do find triggers, that you are finding ways to modify them and get them out so that you're less likely to trigger a migraine. So mine is short and sweet. Does anybody have questions? He had the hard part. He had all the stuff that I covered in my last one. Look at him. One of my big things though with whiplash, something to know about whiplash, when your head does this jerking motion or you get a side motion, sometimes our small muscles that line your spine decide that they want to take a nap. And you don't really know that until all of a sudden you're having all of this is painful and stiff. So coming to a physical therapist just to see if all the muscles are acting the way they're supposed to be acting, because our bodies are super good at compensating and making us functional, but that doesn't mean they're working right. Yeah. And you're not going to notice it until all of a sudden you're adding on like, oh, I'm constantly cracking my neck and I'm constantly feeling like I'm stiff, and then I've got these headaches and they feel like they're back here and then they kind of go up and around. So even just checking in with a physical therapist can be really helpful. Even we're happy to see you for 1 to 2 visits and clear something versus I'm going to see you if it's chronic. That's going to be a whole lot easier to fix if we get you right away for brain injury, headaches, or whiplash, or dizziness.
And I like what you said, and sometimes just like I saw a kid with headaches, but one of the other things that the parents did was because of the on-screen time, the posture.
Yes.
Oh yeah. So when you tell kids to sit up, they feel like, or to sit far away from the TV, they feel like, oh man. And you're moving away, you can feel them getting closer to that, or they start doing that again. So just small little things like that, like correcting posture, taking frequent breaks, like you were saying, taking frequent breaks from electronics, not taking a break from watching the thing and then they go and play video games. So I tell them that's the time to go and drink your water, help load the dishwasher and things like that, chores. That's when they can do those small little chores. They feel rewarded. You load the dishwasher, then you can go back and watch the next episode of Stranger Things. And then notice that with the Netflix and all of them shows, there's next show starts in 1918, 17, yeah. And then we all do it, we're raging, right?
You don't wait.
And then next episode, you skip intro. So I tell them that, no, let it run. Go and drink your water. Let it run. So small little things change that you can do at home like that could be very helpful. They might seem like, it's nothing, but you could be surprised, just like the distance from the eyes when they're holding their phones. Teenagers, they look deformed, right? Holding their phones. Or teenagers are like this, as if they're deformed, they're holding their phones, right?
Or read books all day.
Yeah. So small little changes can.
And always check vision. If you feel like they're struggling with things that have to do with vision, always make sure to get that checked annually. I've had kiddos who have had like new astigmatisms, or they have a binocular vision issue, which is a vision issue that requires both of your eyes to work together, and it's often needed for reading. And so just making sure that you are doing your annual checks for that, because it's often an easy way to fix daily headaches with schoolwork, and encourage your kids to read more because it doesn't bother them as much. Any questions?
Yeah, I have just like a referral question for you. So I also work with a lot of kids that have kind of these chronic issues, and it does seem like nutrition is like a common theme. Like, do you have any good recommendations on like someone in the community that you refer to, like a dietitian that specifically works with like kids and teens?
No. Do you, Dr. Gutu?
There's several, but I haven't teased out like one who is, I know some that we can work with, that we do ketogenic diet to get a co-managed ketogenic diet. But I think that's a good question.
I just feel like it's something that's hard. Like we, in our little 45 minutes, have so much to cover, and like diet seems to be a common theme that, it's sort of in our scope as therapists, but I mean, not I just feel like if there was someone in
Yeah.
Yeah, so
need.
I like what you just said, because if you go to big centers, let's say like Mayo and all that, they have, when you go to the migraine center, they have all these disciplines, it seems like about 4 or 5 people, right? So I think she's just
Mhm.
telling us that we should
Yeah.
I think we need
look for
Oh,
somebody,
that's very-
somebody with the
Yeah.
same approach, with the conservative approach and all that, and focus on nutrition, diet. I like that. So we can become part of
Yeah.
the team and I like
I have somebody for adults, but they're not in the community. They're out of Atlanta.
Okay.
dietitian that works with the cross country teams?
I don't know. We'd have to
I don't
ask.
remember.
Yeah.
Ellen Davis.
Oh, that's right. Ellen did.
Yeah, Ellen Davis.
Yep.
like I said, because that was like when I was working at a different facility, when I went to ask a dietitian, said, hey, I have this dilemma, the one with the apples,
Yeah.
was, you want to work close to them. But she gave me some other things too that I was looking into. Okay, just like dietary. I see kids with a different type of condition, I won't say it now, but one of the approaches for that is dietary. I'm not talking about the epilepsy, ketogenic diet, I'm talking about some other condition. But you see that dairy-free, they put on dairy-free, gluten-free, sometimes just gluten. So that's why I say it's very, very good just to write and document carefully. You might see that there is a pattern following. But it'd be nice, like what you say, that is there one who's interested, like in migraines and other things, with approach from a dietary perspective. I think that's homework that we have to, we're gonna work on that.
Yeah. We do work with one for athletes, so we can talk to her and see if maybe it might use her.
Yeah,
information.
I would have tons of referrals. I have a lot of consultation work too, so that's
Do you
big.
have a
but-
referral? We'll get her. Okay. She signed in, so. Yeah, I currently use a nutritionist out of Atlanta for certain adult patients. I don't tend to go the nutrition route until it's like a last option. I'm a firm believer that if you don't skip meals, it's really helpful. And if you eat a healthy diet, I mean, I was a kid who during high school lunch, I ate Doritos and queso. Like, I know that high schoolers have the worst diet, so just,
I mean, I was trying to.
yeah, well-rounded diets, healthy, yeah. Yeah, it's hard. I had a girl post brain injury that it was hard. She was skipping breakfast every day. I'm like, well, you're gonna have a headache then because you're skipping a meal and your brain needs nutrition to heal and you're not giving it to it. So it's tough. Well, I'll let you know about that one.
Maybe there's something that I need to see you. I don't want to see that. I'm just saying,
The dietitians at
it has.
They are pretty good,
It's like
yeah.
A lot of the
big
ones that you
medications
use are more so for
become used
diabetes.
Okay.
Plus, you can
So
also,
the ones
those
that
big medications,
I
then
think
that's
are-
what I do want.
Yeah, I'm big on
It's a
whole meals, balanced meals, making sure you're not skipping meals. But then I'm also really big on migraines. Individuals with migraines tend to have like GI motility issues where they're not going as often, they're constipated. And so I do a lot with like deep breathing and vagus nerve stimulation. Just trying to see if we reduce how active their system is, if they will just naturally start going again. I have somebody that got here she's been seen in a different city completely for physical therapy for, I don't know what they thought they were treating her for, but she has a brain injury. And she was just pushing through on medication and caffeine. And as soon as we like had her reel back and do graded exposure and reduced her sympathetic arousal, like she no longer takes any of her GI stuff. And so just kind of relaxing their system so their bodies can do what they're supposed to do is a big thing. And that can also be, do they need to see a psychologist for stress?
Boils down to stress.
Yes.
Yeah.
A lot of stress. And Dr. Shapiro saying she'll be speaking to some non-medical interventions that can help some of the GI stuff too. So next week she will be here.
Okay, great.
She's listening in. She was with me in November when we did an adult migraine session, and honestly, they are pretty much the same. And that's why my big thing is if I can teach parents and kids to be better about their migraines, you can be adults that are really good about your migraines because you'll continue managing them into the future.
I was just going to add on to what you said earlier on, and adding on to what you said about adults. especially when it comes to migraines. I feel that we have a better shot at kind of taking a nip at the bud in pediatrics, because the reason why we're trying to avoid them being on daily medications so that they don't grow up to be adults who are taking daily medications. So we're trying to see, can they change some of these things? And I found often when I was training in neurology, because we do adult neuro, that it seemed like for the adults when they came in, it was just more interested in medications than lifestyle adjustments. And that's most of the time I find that it's sort of like you're fighting a losing battle, because there's some things that need to be taken care of. So that's the whole process of trying to say, can we do something whilst they are little, before they become adults? Can we change some of these habits so that maybe some of the headaches, no matter how much you try, we end up putting them on medications and other things because they're just so difficult. So, but the whole point is try to avoid being in that situation, and then some of them you cannot. So just adding on to the adult.
Yeah. And my favorite analogy, and I just came up with this recently talking to a patient who was having a hard time creating her New Year's habit. When we are infants, you learn to walk through habit. You fail a lot, you fall a lot, but you still get back up and you do it. It's easy. And then you do it the rest of your life. Never decide that you want to crawl again. But if we don't teach them younger, how hard is it for you to start a New Year's resolution every year? That's why everybody fails at it and we start over in January again. You have to start small, and you have to start as soon as you can, because you're never going to succeed if you just don't try to do it. We don't, like I said, we don't think about walking anymore. It's just what we do. But as infants, you don't do that. You don't sit up, you don't crawl. But it happens so fast when you do, Tessa. Your kiddo, as soon as they start moving, they're on the go. They're crawling, they're all over everything. They can't get them out of it, and they never stop again. So if you teach kids to be active and eat healthy when they're younger to take care of these migraines, it's a whole lot easier as adults because they've been doing it for so long.
She asked me about, she was hoping that I would touch a little bit on some medication. Maybe that's for another day, but I just felt like today we just wanted to kind of start with the basics, and then when it comes to migraine preventive medications, it's a whole big topic. And then there's some things like, well, Toradol and a few other things that I was just saying, well, some things they're better off like in the acute setting, like emergency room and all that, and then there's some. So it's a big topic. In case you're hoping that I'll touch on medications, but I just feel that that's another conversation we can have. You can have with your doctor, or you can see you in clinic, and then we can continue that, because it's another whole topic in case you're hoping that we'll touch on medications. But we just want to start with the basics. What can you do at home before you get to that phase where you have to see maybe the primary care physician, and then after that the specialist, and then you see all the specialists. Are there some other things that you could do in recognizing what are migraines? Can we do something else? But if a kid is vomiting, waking up in the morning, vomiting first thing in the morning, they can't move one side of their body, they're losing vision one side, well, that they need to be seen as soon as possible. I just didn't touch on that, but they need to be seen, because that's kind of, everybody worries, it is a stroke, they have a tumor or something like that, but that's when you need to make sure that you get seen by somebody else. But I just don't want to touch on medications, because when I give a talk to the practicing physician, that's a whole topic just on the medications themselves. So just want to mix the two together.
Yes.
Have you had some that had special needs come that had a lot of issues in the neuromotor be very successful even if they've been somewhere else for years?
Tessa, do you have anybody with neuromotor developmental?
I mean, that's a big area.
I know. Well, okay, my daughter is hearing and vision impaired. She was a pound two. Her twin sister was 212 when they were born. And she had a ton of therapy done at another place. That's really good with kids, but she still can't do a lot of cross midline things, but I just don't know if there's anything else we can do.
Yeah. Sometimes it's good to get a second opinion. Not all physical therapy practices are the same, just like not all physicians are created equal. We all have the similar backgrounds with our education, but once you leave school, what you do with the practice that you're in and the continuing ed you do is completely different. I know we have many stories where people have gone other places and come here and they actually get better. And they weren't for years, and then other way around. So we are also a physical therapy clinic that we spend the full 40 minutes with you. We don't pass you off to a tech. You're with us the whole time. And that's different than some other physical therapy clinics. And is one better than the other? That's up to everybody's personal preference on what you like. And I think you need to look around if you are stuck where you're at. Any other questions? Okay, we're gonna wrap up for today. So our next session is next Thursday. Dr. Marla Shapiro is a neuropsychologist who specializes in sleep. She's in the Des Moines area working as an independent practitioner right now. And then Dr. Tessa Klein-Holterink is our occupational therapist who treats pediatrics and adults. So they will be here to talk about general sleep and things to look for in kids who are in school and academics. And then Tessa will be talking about how sensory integration and neuromotor development can help. Oftentimes, if we have systems that are weaker than others, it can cause a predisposition to have more issues with those systems. So working on getting those integrated can help reduce your trigger load. So they will be talking about those next week. And we hope you can all come back.
Thank you.